Good evening to everybody. Thank you. And good morning, good afternoon, good evening to everybody who's joining us. I'm Nashwa Naushad from SE for All. And thank you for joining the second day of the International Online Conference on Electrification of Healthcare Facilities in Africa. This is truly an international online conference because yesterday we had participants from all over the world. So thank you so much for sticking on. Yeah, day one was absolutely fabulous. We had a great set of presentations. We learned about the Sustainable Energy Policy Hub. We had like a tutorial, a walkthrough. And then that was followed by a very good discussion moderated by my colleague Rahul. We had representatives from UNICEF, WHO, and Power Africa, and they touched upon various key subjects. There was so much information there. I could not recap everything, but I did think we could start today with a little bit of the points that were covered so we could maintain that sort of continuity and that flow into today's discussion. And I am very excited about that. So yesterday, I think we saw quite a few things, but one we touched upon, or the panelists spoke about the kind of progress we have made, the inroads we've made into the sector, which is technology and financing, but also how there still are many, many challenges, including the availability of data, the coordination and the significance and lack thereof of coordination. And but the one word or the two words we kept hearing, or the few words we kept hearing over and over again, was sustainability and O&M. We keep hearing that it's a challenge for the entire sector, but it was great to hear from the experts about their thoughts on O&M, suggestions for what could be possible models that we could adopt, all to avoid the install and forget approach where we install the solar panels, come back, and then 2 years later, they're not working. So all in all, it was an absolutely brilliant discussion. And I'm very excited that we're continuing the conference on day two with an equally brilliant set of panelists that we have waiting here. Before we jump into the panel discussion itself, just a quick reminder of the sessions we have in store for you today. The first one is the Multilateral Compact for Health Facility Electrification and Other Approaches, moderated by yours truly. And the second session will be regulatory modifications to remove barriers and facilitate delivery, moderated by the amazing Daniela from the African School of Regulation. So with that, we'll get the session started. Unfortunately, you'll hear from me for a few more minutes before I bring in the panelists, just to set the scene and to give a little bit of the context for this session. So for those of you who don't know, the Multilateral Compact for Health Facility Electrification was adopted or was convened and launched by SE for All and Power Africa in 2021 when we brought the energy and health sector together, co-convened key stakeholders to launch or to adopt the compact. The aim of this compact currently is threefold. One is to look at data, to make data more available, including where are health facilities that are currently being electrified, which ones are not, et cetera, to facilitate implementation, to boost implementation within the sector, to get more commitment from the sector. It's not a legally binding commitment, which is always something we get asked, but it's an aspiration for the sector to work towards. So it's a figure that we all have in mind and we're working towards it. And thirdly, coordination, to add to the coordination mechanisms, but to see how we can bring the sector together, share knowledge, etc. And you'll notice that these are the three challenges, some of the challenges that was highlighted yesterday as well in the panel. So that's what the compact was really launched for. Currently, we have some really ambitious targets, including an implementation target of 35,000 health facilities by 2026. conducting at least 30 national or subnational market assessments, which will inform how many health facilities in a country or a region need or can be electrified, need to be electrified, with some information on how this can be achieved. And thirdly, to continue convening the sector together, jointly putting our efforts together to bringing everybody together. So far, the number of health facilities. So one of the things that we do as part of the compact is to track progress. And since 2021, the number of health facilities which have been electrified by the compact signatories is roughly 6,000 facilities. That is 1/6 to a goal, but this does not include the number of health facilities that are currently being electrified. And I have no doubt, I think the sector has no doubt that we'll hit this target by 2026. But what we want to think about, and one of the main reasons for this session is also to think, what else can we do? What else can we do to accelerate progress? What are some new targets that we can adopt as part of this compact, and so on and so forth. Last point from me, before I start the questions and the discussion, just a quick one on what SE for All is doing as part of this compact, what our contribution has been. With respect to implementation and data, we are committed to improving market intelligence. So we've done 4 roadmaps so far. Nigeria, Sierra Leone, Rwanda, and Madagascar, and we have 3 more that we are working on currently. Implementation, we want to help others implement, but we've also implemented, or we're also implementing the Sierra Leone Healthcare Electrification Project, which has electrified 43 health facilities. And thirdly, coordination, we work with other partners to bring the sector together, be it events in the margins of World Health Assembly and UNGA, but also more importantly, we have our upcoming Energizing Healthcare 2025 conference in Nairobi in February. I will provide more details in the chat in a bit, but if you want to attend, please reach out and we can send you an invite for that. So without further ado, I will stop talking and bring in the wonderful panelists that we have with us today. So the first question, really, Matt, is to you. It's going back in time a little bit to look at how the compact was envisioned. But before that, I'd like to say, panelists, before you answer the question itself, please, if you could introduce yourself in one line, their name and your title and your role, that would be great. But coming back to the question, Matt, I thought we could go back in time a little bit. In 2021, Power Africa was one of the co-conveners of this compact. What was the vision of the compact? What was envisioned back then? But also right now, Power Africa's flagship initiative, HETA, Health Electrification and Telecommunications Alliance, is doing amazing work. How does the compact complement what HETA is doing? Over to you, Matt.
Excellent. Thank you so much, Nashwa. Really appreciate you guiding this conversation, and it's such a pleasure to connect with all of you today. So thank you so much for having me. Really, really appreciate it. To those of you I've not met, my name is Matt Clark, and I have the pleasure of serving as the Partnerships Director for HETA, which is the Health Electrification and Telecommunications Alliance. As Nashwa said, we are Power Africa's signature initiative in this space. We're a 5-year initiative that is our headline goal is reaching 10,000 health facilities in our first 5 years of operations, bringing sustainable energy and also digital connectivity access to those 10,000 health facilities across sub-Saharan Africa in our first 5 years. So I know we'll talk a bit more later about that second half of our work, the digital connectivity piece that goes along with the sustainable energy access. But to your opening point, Nashwa, about sort of the inception and the vision of the compact and how HETA's work is aligned with that. When I joined HETA just about 1.5 years ago, so it was well after the compact had been established, when I was sort of being read in and brought up to date on what the compact was all about, HETA's origin story, how the things were connected, and sort of all the players in the space. To me, what became really clear very quickly was of those three pillars you mentioned in the initial vision, the sort of tent poles of what the compact is supposed to be all about, that data collection and sharing, the implementation work across sectors and stakeholders, and the coordination across both the energy and health sectors to exchange lessons learned. To me, the thing that became very clear immediately that I personally, anyway, I see the value of the compact really being this human element of collaboration and coordination. I think there's in the world, in not just in the energy access space, but in the world of sort of, international development and social impact broadly, there are, of course, a
Okay,
ton
this is
of
this is
of
this is
coalitions,
this is
of
what I would do.
alliances,
Okay,
of
I
compacts,
would extract
of
the
groups of
portion.
folks doing great work. And I think sometimes, at conferences or convenings, other events, when, yet another coalition or alliance or group is announced, I think sometimes we have sort of a tendency to roll our eyes a bit, frankly, and say like, oh, great, another another group, another association. What does it actually mean? And to me, the power of the compact and what's really been beneficial and value additive is that human element of collaboration, of partnership that I think we don't spend enough time talking about. To me, I think the need is clear. The approaches we understand generally, obviously, in the coordination of implementation work to make those approaches bear the most fruit is necessary. But what I have benefited from most since joining HEDA anyway, a couple of years ago, is the brain power that the compact brings together. It is opportunities for folks to be connecting like this. All of the folks that we collaborate with really closely on a regular basis, the fellow members, the partners of the compact. It is not only a huge asset and value additive to HEDA's work, but it really goes a long way in genuinely guiding and framing our approaches and informing how we're showing up in the now 16 countries across sub-Saharan Africa where we're active in some way, shape, or form. So I think that's my overarching answer to your opening question about what is, what was that initial vision and how is it playing out in these first few years? And to me, where we should really focus on continuing to guide and grow the compact in the years ahead. And then the last thing I'll say very quickly is just the other, I think it was part of the initial vision and the way that the compact was designed, but certainly it's been the case for as this has played out in the last few years, is that via the power of bringing that brain power together and bringing the leaders from the respective organizations talking to one another, it also creates space for us to talk about and prioritize excuse me, the additional sort of add-on or side elements of work that are value additive to the primary focus of that sustainable energy access for health facilities. So from a HEDA point of view, that's primarily digital connectivity, which again, we can talk about later. But it's also all of the other fabulous work that some of these partners are doing, not only in digital connectivity, but WASH and in gender inclusion work. And, the list goes on and on and on of the plus work that these different members of the compact are interested in from their various vantage points. So to me, that is core to the compact as well. Yes, our overlap in the Venn diagram is access to sustainable energy for health facilities. And each member brings other priorities and expertise to the equation that overall we all benefit from. So that's how I think of the compact.
Thank you so much, Matt. Very well said, many things, but also the brain power. I really liked the point about the brain power. And we have 23 signatories, each of them doing amazing work. So bringing all that knowledge together to catalyze the impact that we're having is a brilliant point. But with gender inclusion, I think I'll segue. That's a good segue into bringing any of the other panelists, but I will bring Ambrose from We Care Solar in, also to give us a different perspective from the private sector. What does the compact mean? And We Care Solar is doing amazing work on the ground, and I'll let you speak a little bit more about the amazing work you're doing in gender inclusion, but what does the compact mean to a private sector player such as We Care Solar? And how is the work that you're doing on the ground contributing to meeting the targets of the compact?
Thank you very much, and it's exciting to be here. First of all, as We Care Solar, it's very exciting to see that there's a huge momentum being built towards addressing the global challenge of energy and health facilities. And in 2010, when We Care Solar started, it was a lonely voice. There were very few players. There were very few organizations pushing for this. And when we won the UN DESA Powering the Future Award in September 2015, there were clear statements that were raised by our ED, and critical ones was around a signal, the global health care, that renewable energy required momentum and was coming with reinforcement. And the other issue raised was that we need a variety of solutions, many players, we need a collaboration, but also wanted to look at building local capacity so that renewable energy solutions are installed properly, they're used properly, and maintained over time. The challenges you mentioned from yesterday's discussion are the issues we saw over 10 years ago. But then now, we're excited to know that the Energy Compact and several other partners are giving hope to very many facilities in sub-Saharan Africa. And so looking at the compact's target of 3,500, of 35,000 health facilities, as We Care Solar for us, we believe that we know where to go. We have all the experience for the last over 15 years of dealing with governments, of building coalitions with different ministries, health and energy, international NGOs, signing all sorts of agreements that have really allowed us understand the terrain of health facility electrification. Now, what makes us unique is that our focus is maternal and child health. And the question would look like this is basically a very small area of the facilities. But then we know that addressing the critical time of childbirth is very instrumental for health facility electrification, because pregnancy and childbirth can happen anytime, any day, can be day or night. And what we would call routine can change into an emergency. But our facilities, which are level 2, level 3, how prepared are they to deliver these services? And if you've traveled across the facilities and in Sierra Leone, in Liberia, in Zimbabwe, in Mozambique, you find thousands of them conducting deliveries using candles and kerosene lamps. So our aim has been to be able to address that critical gap of maternal newborn health across the different countries. And so having the several partners come together and organizations is critical for us to see that we can all be able to support the different sectors of facilities, the different departments, and be able to address the energy gap in the facilities. And on the compact itself and the different objectives, I would highlight the issue of supporting over 5,500 facilities in the last 4 years of the compact. And this has been across the many countries in Uganda, Sierra Leone, Zimbabwe. Are you hearing me? Yes. Nigeria, and targeting many other new areas as we see later in the discussion. So if I could basically touch briefly on the issue of the gender inclusivity that you bring up in the next part of the question. One is that we have been operating on the norm that can women support women? women for women. And this has looked at different dimensions. One is being able to promote women solutionaries, women installers, and we've contracted several companies across the different countries where either it's a women-led group or it's a mixed group where we have men and women installers. And aware of the barriers for women in STEM, we even went ahead to recruit female installer groups that are typically all women. And one of the groups that won an award in Sierra Leone, where we recruited 8 women, trained them, mentored them uniquely to ensure that they can support installations. And this is from experiences where you go for an installation and there's a delivery taking place and a man can walk into these delivery rooms. So we supported the women installers in Sierra Leone, and these have installed over 800 solar systems in the country and now going into the transition phase of maintaining them. And the other part we supported was in Liberia, where we had a group of mixed female and male installers. And one of the more prominent installers who trained there, called Flo Moyanga, is someone who believed she could be a nurse because she never saw anybody, any female in her community, be involved in installation of solar systems. And now she has co-founded an organization called Women in Energy, WIRE, and she continues to support our systems, continues to travel to other countries to build capacity for other installers. And so we look at supporting women for women, and also aware that over 70% of the health workers that support deliveries are mainly women across sub-Saharan Africa. So we are supporting women to support other women, as well as be part of the solutionaries. And then also we know the cultural norms that challenge all these kind of STEM investments. So trying to break those barriers requires us to be very, very intentional in building the capacity of women and be gender inclusive. And to be able to improve on the targets, I would just highlight the few indicators we have on our board in new strategic plan that will be beginning next year, where we are tracking workshops that are gender inclusive, tracking how many technicians are female in all the groups we recruit, but also tracking teachers that are female in the teachers we train to build capacity for the STEM subjects. So for us as we care solar, the exciting bit is that we are having now everybody interested in supporting energy, and having HETA here is very exciting. We've partnered with HETA in Nigeria to support Bauchi, where we have just completed installations just this week, and being able to look at how we can engage other sectors in supporting HFE. Thank you very much.
Thank you so much, Ambrose. That was so inspiring to hear about the amazing work that you're doing, especially mentoring and training women. And we've all, everybody here, at least on the panel, but also many in the audience who yesterday we learned were intermediate or beginner. I mean, no beginners. We have only advanced and intermediate experts in this group. But we've all seen a picture of, or we've seen these instances where the delivery happens with the mobile torchlight, and that's I can't even imagine. We sometimes can't even imagine the horrors that might be like, in real life. So it's great that We Care Solar is doing so much to change that situation and also include women in that process. And I mean, it's great to hear about that. So we'll come back. Maybe that's something we could include in the compacts. We'll come back to that in a bit. But my next question is to Noor, and the question was, so UNICEF is part of both the compact, as a signatory of the compact, as well as the Health and Energy Platform of Action hosted by WHO. How is the work that UNICEF is doing contributing to both these mechanisms, can I say, and also what is the significance of data and coordination in your work?
Thank you so much, Nashwa. Hi, everyone. Good morning. And Good evening. It's really a great pleasure to be here with the great panelists, and I can see that there's a great turnaround from people from all over the world. So very excited to be just talking a little bit on what is UNICEF is up to, and a bit of a disclaimer, a public announcement. I'm a few days into my delivery date, so I'll be losing my breath a lot. So just FYI. So yeah, as we all know, electricity in healthcare facilities isn't really about just providing energy. It's about actually saving lives and ensuring that vaccines are delivered and stored safely. Emergency surgeries are actually possible, and health system can actually function in times of crises. And working on installation is great, but also going beyond that is very important as well, which is a segue to data and technology. So at UNICEF, we really see energy as an enabler for a better healthcare outcomes and a stronger, more resilient communities. So UNICEF has released their strategic sustainability and climate action plan this year that looks at energy as an area of acceleration for all sectors that we have: WASH, education, health, nutrition, gender, and even social policy. And just focusing a bit more on health, since 2017, UNICEF has actually scaled up their solar solutions globally. And we've supported around 88,000 solar vaccine cold chain fridges. There is a global goal and plan to electrify over 30,000 healthcare facilities. Ongoing, we have a global partnership with WHO and Gavi and other organizations to electrify 1,000 healthcare facilities in Zambia, Ethiopia, Uganda, and Pakistan, with a hope through that partnership alone to electrify 10,000 healthcare facilities by 2028. To be honest, I've been working with UNICEF since the past 2 years as an energy and environment specialist, and what I've noticed, like implementation has been really rapidly growing, but what I've seen that is very critical and important is coordination, and how it plays a critical role in actually achieving the goals that we want. You cannot work in a silo in this sector. It's almost impossible. So we've been building lots of partnerships with SE4All, IRENA, HETA, and we're also doing kind of an investigation with a potential pilot with the PIDG on looking at innovative models that goes beyond installation. We know that O&M has been discussed so much, and I know that people sometimes might get sick and tired from hearing that, but this cannot be even emphasized enough. We need to stop installing solar just for the sake of indicators and checking donors' indicators or our own strategic plans. We really need to think it through. One of key successes is, thank you so much, Matt. One of the key success factors, I think, is working with the private sector. Africa is the biggest market, emerging market currently, and the private sector is skyrocketing with the renewable energy prices going down. I think this is a very good avenue to, it's a low-hanging fruit, but it's just how we phrase that modality, how we know how to blend financing, how to actually create funds. Capacity doesn't anymore have necessarily to come from us or from donors. It can be shared. Private does have CapExes to share, but it's just the modality and de-risking them and making sure that payments are coming in time. And just lastly, just to come into data and technology. Currently, especially on energy, we really are using that as a driver to what we're planning to do next, especially at UNICEF globally and from the Eastern and Southern Africa regional office that I'm coming from. So we have basically designed a tool called SunSavvy. It's a solar sizing tool for non-technical people to actually identify their financial needs, the carbon reductions, and also needed capacities for their systems. This tool has been tested out in 18 countries. 3 governments have been trained to use that tool, and it's an open source tool. This is just one of the elements just to make sure that the systems are designed effectively and efficiently. And one of the most important things is data-driven decisions. So we have been building investment cases, contextualized investment cases, concept notes, and we have recently released our regional market assessment in the Global Engineering Conference in Rwanda a month back, which looks at the landscape of the renewable energy markets. What are the gaps? Diesel prices. What are the potential avenues, low-hanging fruits countries, and so on. So making those decisions, having an informed implementation plan along with an operation and maintenance plan is essential. Like based on the renewable energy market assessment that we've released recently, around 16,000 healthcare facilities are not electrified in Eastern and Southern Africa region, and around 130,000 schools does not have access to electricity. And I think in this day and age, in 2024, this is a complete disaster. And at the end of the day, this work isn't just about, as I said in the beginning, energy installation. Now we can see that impact on the long run, not for a year or two, but actually for 5, 10 years at least. I don't want to say 20 years. I know this is quite ambitious for solar systems, but at least we hit the 5-year mark of sustainability. So yeah, that's it from my end. Thank you so much, Nashwa. Over to you.
Thank you so much, Noor. Congratulations, firstly, on the expected, and good luck on the expected delivery, but also many amazing points made, including how much UNICEF is contributing towards all 3 aspects of the compact: data, coordination, and implementation, and specifying on the importance of coordination. So that was great, Noor. Thank you so much. Finally, Harriet, last but definitely not the least, coming to you on more coordination related. So T has been convening the wider sector through, let's say, the forum that happened earlier this year. And many other partners, you constantly bring many partners together. How do you view the role of partnerships and coordination to accelerate progress, not just in this sector, but also widely?
Great, thanks, Nashwa. Yeah, hi, good afternoon, good morning, everybody. Thank you, firstly, to Ambrose and Noor for really bringing in the people aspect and the impact that we're all working towards with the electrification of health facilities. I think it's so important to always remember that there's people experiencing and using health facilities with no electricity. We're doing it for them. So quick introduction to me. So I'm Harriet Bradshaw-Smith. I work for the Carbon Trust. We manage the Transforming Energy Access platform on behalf of the UK government. It is a partnership made up of over 700 different types of organizations spread across the world in Sub-Saharan Africa, South and Southeast Asia, and the Pacific Islands. We're a research and innovation platform. We do many things to do with supporting the technologies, business models, data, skills needed in order to enable a clean and inclusive energy transition. So we've come to the electrification of health facilities game quite late. So after the Energy Compact was started by SE for All and Power Africa in 2021, we didn't start having any healthcare electrification projects until 2022, when we partnered with SE for All to fund the Powering Healthcare program. And it was really because of the beginnings of the Compact that led us towards having a leave no one behind portfolio, which had this focus of healthcare electrification. And where we support is with that data piece, is with the coordination, the team, at any opportunity when there are big sector events, bring together different stakeholders. So at the T Forum, we had a private sector sort of workshop, an all-day workshop where we had many actors in the room discussing what they were doing, the challenges they were facing, and thinking about solutions. And unsurprisingly, most of them had the exact same challenges, similar solutions, and we're just really trying to encourage everybody to come together to share those moments. We then in Nairobi, the Gogla Forum, SE for All had a workshop with government representatives, and that was incredible. We heard from about 7 governments on what they're doing for their electrification, and they were coming from the energy side and the healthcare side. And it was really interesting hearing what they were doing. But what was the best thing for me anyway, as a coordination perspective, is at the end of the session, 3 or 4 countries with multiple representatives, probably about 15 of them, gathered at a table to continue discussions so that they could learn from each other. And I think that's really what we want to be seeing as we move in. Like, I think for a research and innovation platform where we're quite embedded in the off-grid sector, we have loads of different solutions there. We have lots of learnings and lessons that can be utilized, and I'm just here to really support the processes as they and all the other stakeholders who are involved in the transition for the health electrification. But yeah, I can leave it there, Nashwa.
Thank you so much, Harriet, and one of the key funders in this sector. So it's really nice that you've got that vision of coordination as well, because then it's shown, it's visible in the kind of impact that we can create together. That was an excellent round one. We do have one more question for each of the panelists before we open the floor for questions from the audience. And this is just one question for everybody, and we'll take I mean, if you could take turns answering, that would be fabulous. So we've heard a lot of things today so far from the panelists here, and including some co-benefits or side things to look at, like Matt pointed out, and many others have also pointed out here. Could some of these become targets in the compact, or could we strengthen some of the existing compact targets? What is needed in the sector to catalyze progress? What can be done in addition? And what are some of the new targets that we could adopt through the compact and ensure that we monitor and achieve it? So I'll first start with maybe Noor.
Amazing question, and I totally see the point on indicators and why is it important to track progress. And on the targets, I was looking at the compact yesterday. I was like, what is it that we need to actually add to make it more robust? And one of the things that I really like just popped up in my mind is just how we can actually translate the outcomes, the delivery outcomes that is linked to health service. Basically, looking at it from a point of view on how does that impact people. For instance, the vaccine coverage, safe childbirth, how many mothers have been serviced by that, maternal survival rates, emergency care, child immunization coverage. We could actually test our response and the impact of our response through that. Another thing, I need to say it again, operation and maintenance is a top priority. So too often the healthcare facilities struggle because they don't have a plan for that. Maybe just in indicating some sort of an indicator, identifying how many active operation and maintenance plans after we install, how is that embedded in the maybe health facility regime, or that maybe district ministry of some sort, if they have sufficient fund, if they don't. Maybe just trying to understand if O&M plan is in place, working or not working. Also working with the local providers. Sometimes we feel that it's too easy to work with our existing LTAs, the long-term agreements that we have, whether it's UN agencies or like the private sector or whatever, and we sometimes neglect looking for that service to be provided by local companies. They are in the field and they are the closest to the healthcare facilities that we have. And they are more keen towards those small profits than bigger companies, to be honest. So working with them is very, very important, maybe having indicators around that. And also being a bit courageous in testing it out. Everyone wants to test out O&M modalities in theory. No one is actually putting financing towards that. We've been investigating a lot for the past month, trying to understand who has implemented a functional blended finance model, or not functional. We just want to see the learnings. The thing is that I don't think we're courageous enough to put financing towards testing and piloting. Maybe sometimes it's a bit confusing on how to report to a donor to say that my project failed. but failure is good at this stage. We need to learn. And just finally, one of the things that I think that are really essential is defining sustainable energy. It's not only, let's say, reliability aspect. It really is like a multifaceted thing. Affordability, for instance. I was working in one of the refugees, one of the refugee camp communities where electricity is there, but they just cannot put the plug. They cannot afford electricity. And reliability is a great aspect as well. Like, for instance, when I was in mission in Comoros, electricity is accessible, but it's, and when you go online, it's 99, I think it's over 90% access to communities, but the generation capacity is almost not there. 40% of communities actually have access, whereas in the reporting and the physical access of the grid is almost there. And also, very, very important thing is climate resilience. In Mozambique, lots of solar systems just flew away. And even if your system is affordable, even if it's reliable, even if it has an amazing O&M plan, if it's not constructed well to adapt to climatic shocks, it's not sustainable. So redefining sustainability as well, also having that role, it's there. Like, we all agree that sustainability is 1, 2, 3, 4, 5, and this is what it means, would be really, really great. So yeah, thank you so much. Over to you, Nashwa.
Thank you so much, Noor. I'll probably ask Ambrose to answer it as well. I'm conscious of the time, so that's why I'm not recapping, but Ambrose, over to you.
Thank you very much. I'll try to make it direct, as she has already mentioned most of the critical things. The new targets for me, and as we can sort of look at the geographical targets, we know that where is the highest population, which one is the most affected, which population is most affected. So that would be very critical in ensuring that we can be able to reach a greater impact. On the second, coordination, accountability, so that we know what is happening and build into the same indicators so that we can be able to track performance and the targets that we are trying to work on. And then critical to us is the issue of capacity building. As we cast solar, we try to ensure that we support the local organizations, build capacity for both the private and the public technicians, as well as the health workers use the technology. We have seen challenges where, you're training here and the next week another partner is training in the same area. Can we be able to jointly coordinate in capacity building? After all, it's the same renewable energy and the same users. So can we be able to jointly build capacity? And it's very ashamed to find a facility with the 10 different panels on the roof and huge battery banks, but there's no energy that is happening there. And I don't want to highlight a few, several things, but I think there's a need to coordinate to be able to build capacity and ensure that there's a local capacity to run these systems. Sustainability has been mentioned, and yesterday's session, they said, being able to support the system forever. The question is how and who is supporting this. We are providing spare parts in country, we are providing batteries in country, but then we find a market of, very unsafe batteries, poor quality. So we could have a lot of, targeting around the quality and around the sustainability. My last point about policy advisory and how can we target supporting policy as a compact. And you talk about Mozambique. We are entering Mozambique this year. We've set an MOU. The challenges around importation of equipment to Mozambique is huge. And so how do we jointly work together to target policy reviews and advocate for improvements? So I'll leave it at that, but my call is that we can work together and address the common challenge. Thank you very much. Over to Nash.
Thank you so much, Ambrose. Over to you, Matt, for your thoughts on what a new target could be.
Thanks so much. I find everything everyone is saying in this group, I find myself almost hurting my neck. I am so vigorously nodding in agreement. I love this discussion. You know, the headline thing that I'll mention again, since it's central to Hedda's work in particular on the digital connectivity piece of things, is that we know as a baseline, folks across the continent of Africa, nearly half of Africans do not have access to internet. It's about 42%. Across the continent. So we know that as a baseline of a reality that we need to change. And we know that by targeting health facilities as sort of an anchor digital connectivity access point for communities, you allow that many more people to have access, even more than, you know, targeting individual homes or other facilities, for example. So I think there's obviously an indicator there that we can and should be tracking to increase that digital connectivity generally. And then more broadly, to tie it back to some of these other themes that are being explored, just a couple of other really wild statistics is that Africa as a continent represents about 20% of the world's population, yet it represents just 2% of global clean energy investment. An enormous mismatch there of global funds flowing to the continent for this work. And all of the latest reports say that we need about 100 to 200 billion US dollars per year between now and 2023 in order to reach the continent's target of tripling renewable energy by 2030. So there's an enormous gap between what we know we need to be seeing as that global flow of capital, the investment of dollars coming to the continent to do this work. And the reason I tie that back to the digital connectivity piece is that we know there's an enormous opportunity, to Noor's point, about working better, smarter, faster, and at larger scale with the private sector. Hedda really sees collaboration, particularly in this sector, this industry of, you know, mobile network operators, cell tower company owners, you know, these major anchor players in the private sector in order to roll out more of these mutually beneficial, sustainable business models where these companies, where these private sector players are making investments in the work, not purely from a philanthropic or CSR or ESG point of view, but really that is tied back to their own core business interests. And by doing that, we'll get more of that scale work that we need. And it also then solves for that other critical piece that Noor has pointed out of the long-term operations and maintenance. If we can get the private sector invested not just in those CapEx upfront dollars, but actually, again, having a vested business interest in the long-term operations and maintenance of these facilities and equipment, both on the sustainable energy and the digital connectivity side, so many of these issues are going to get a heck of a lot easier to manage if we incentivize the private sector to have more skin in the game, more return on that investment. Sorry for the ramble. Those are some thoughts.
Not at all a ramble, Matt. Thank you so much for that. And Harriet, now over to you for your thoughts on what new targets, potential targets for the compact could be.
Great, thanks. I mean, mine is definitely less creative than the other panelists, but I would say one of the targets could definitely be about funding, either committed funding or also leverage funding. So, you know, as Matt says, like bringing in those private sector players to have those anchor loads, you know, how much money they're investing in it, and then also what their return is as well, because in order to prove it as a business case that can work, you know, the private sector do need to understand the returns. And yeah, that also just feeds into having like funding diversity as well, like not just the grants and the subsidies, but also, you know, trying to find ways of getting governments to really commit to spending sort of state funds on these vital services for their populations as well. But again, I'll leave it short and sweet. Thanks, Nashwa.
Thank you so much, Harriet, and very important point on the funding diversity. So I'll wrap. I mean, we've heard quite a few points, very important points from this round of questions. So I'll try to do justice when I wrap up, because I'm also aware that we only have 3 minutes to end the session, but some really interesting thoughts on what we can add as potential targets. So we heard about capacity building and the importance of working with local providers, training local workers to then be able to ensure sustainability. That could be a target. That very important point about health outcomes. So we've been looking at it from an energy perspective. Could we look at it from a health perspective so that that is our end goal, and should we track that? Then there was a point about policy, which was very interesting. Digital connectivity, for sure. And that's very linked to what HETA is doing. We would love to have that as well. How can we think about it, but how do we include that? How do we monitor? How do we track how health facility electrification is being used as an anchor for other things, maybe not just digital connectivity, but also other things like WASH and other topics that were mentioned in this conversation today. And that point on collaboration with private sector, Matt, maybe the target there is to add more private sector players to the compact, so we actually create that sort of coalition and share lessons within the coalition. So that is also fantastic. And finally, funding. That's a great point about how we don't track funding. And that's because, Noor, you were also talking about how, not just for testing, but also just as a commitment, it's always, it's not something we can commit to. But Harriet, I like what you said about maybe it's not committed, but it's also leveraged funding, which is by itself is a great target to look at, and how we're tracking different sources of funding that's coming into the sector. These are all, it was fantastic to have this panel. I'm going to check if there are any questions. There is one question. Maybe we can take it very quickly with just one question. So I'll read it out. Is there any organizations that has or have a robust mapping of different stakeholders in Africa so that we can look for better collaboration and synergies rather than duplication of efforts? This is from Karan from Gavi. So he says, at Gavi, we've embarked on a pilot using our CCE platform and would benefit from such mapping. Would anybody have an answer to that on this call? Any panelists that know about this?
I'll just say super quickly in a self-centered way, part of what HETA is doing, the A in our name, is alliance building and mapping those players, particularly in the countries where we are active. So we're up to 11 fully fledged operational countries now across sub-Saharan Africa, with 5 more coming online in the months ahead. So we're expanding across the continent, and part of our work is building that alliance of players on the ground who are doing the frontline work of implementation and community building, community engagement. So it's part of our remit. It's part of the work we're doing. There are, of course, other entities, larger entities, that are doing the mapping of the individual facilities and the all of the great rich data that goes along with that. So we're not trying to duplicate efforts or duplicate anything there, but in terms of, yes, a bigger picture of the network, the folks who are doing the great work, would be happy to. I'll drop my contact info in the chat and would be happy to talk more about that.
Thanks, Matt. And to add to that, at SE for All, we've created a heat map of all the activity, or of as much as we can track through a survey. We can drop a link there, but that maps all the health facility electrification initiatives that were finished or ongoing or planned. And that can also give an idea of which stakeholders are active in this space. With that, I think we are at the end of the session. So I'd like to say a big thank you to our panelists for your brilliant additions and input. Thank you so much. We've seen the power of collaboration just on this call, but we hope to continue. Let's continue working together to electrify more health facilities and get those health outcomes that we might have in our compact soon. So I think now we have a break of 10 minutes and then we reconvene at 5 past the hour, wherever you are. So I hope you enjoyed this discussion, everybody who joined, as much as I did. Thank you once again to our brilliant panelists.
Some tea. Yes, we're back. I hope everybody was able to get some tea, some coffee, stretch their legs. I want to say a big thank you to Nashwa for leading us into the first session, and for providing us with a recap of day 1. I'll welcome all my panelists. 1 second. We have Harold with us. Welcome, Harold. We have Gracia. And we have Irene as well. Welcome to everyone. So we'll get straight into the session. This session will focus on regulation. And I'll go ahead with the first question. And this question will go to Irene. Welcome, Irene. And welcome, yes. What are the most significant regulatory barriers currently hindering the electrification of healthcare facilities on the continent? Perhaps you could give us your view on this, and I'll let the others speak as well. I apologize for the background noise.
Hi, Daniela. Can you hear me well? Yeah, okay, perfect. So to be honest, every time we talk about regulation, I think we need to start really thinking a bit different of what we have done for the past years. If we think about regulation, especially on the side of the off-grid, we think about, in the case of mini-grids, really related to like, how do you get your permits? How do you get your licenses? How do you get all the documents needed to be able to produce, sell electricity, etc.? Or also, how are you protected against the arrival of the grid? If you think about off-grid, we really about solar, etc. We think a lot about tax exemptions, duties, etc. But I mean, we've been working on that for a long time as a sector, I would say, and we have so many templates thinking about what is the best regulation to attract the private sector. So that I would say, on the good note, that work has been done. And we've been working in that for a long time. Today, you have so many templates about it. The question is, why even with those regulations, the situation is not as good as we would expect? Because in theory, those regulations were to lift up the barriers. So I would think to go one step below that, before that, which is the question of, okay, we were developing these regulations in order to attract the private sector for electrification, productive use, people, healthcare centers, etc. And I think that what we are not addressing is the reluctancy of the private capital to invest into this sector under the existing rules. And by existing rules, I will always address what I consider one of the biggest barriers, which is to take the client risk. So, for example, we've been discussing a lot, and we will have a seminar also with the African School of Regulation about mini-grid as infrastructure, but it can be electrification as infrastructure. And the question and the main difference is when you invest in an infrastructure, you do not take usually the full risk of the client paying you directly. Usually there's something in between. So, and just to close the full circle I'm trying to draw here, which is, you asked me what are the main barriers in terms of regulation. And I think the main barrier is that the regulations we have been developing do not take into account the reluctancy of the private capital towards that risk. And we need to think about business model, and thus the proper regulation to regulate that business model that actually address this barrier. I don't know if I made myself clear, so I will just make a small example of that. For instance, let's imagine that instead of electrifying with cost-reflective tariff and some CapEx grant. Let's imagine that the private sector or the investor, wherever it is, whoever it is, gets a regulated return and it's really a concessionaire. Then we should develop regulations for that. How do you assess what does it mean a fair return? How do you enforce a fair return? What are the warranties you get in the back? But I think that when we talk about regulatory barriers, is because we have barely developed the regulations for different business models that are not based on cost-reflective tariff and partial subsidization of the CapEx.
Thank you very much for that comprehensive answer. I think I'll ask the same question to Gracia. Gracia, would you provide us with an answer on what you think are the most significant regulatory barriers to electrification of healthcare facilities?
Thank you very much, Daniela. Hi, Irene. Very nice to connect again. And hi, Harold. So maybe before I start, I'll introduce myself quickly. My name is Gracia Munganga. I work with HETA, Power Africa's flagship health electrification program. I'm the senior technical advisor, so I work across different countries supporting the implementation. I think Irene has made a very good point, and I have not thought about it in that way, but I spot on, right? So currently the regulation is focused on, I would say, business as usual. So perhaps my input would be to contribute to our understanding of maybe some of the gaps. I will not say pitfalls. I think I'll call them the gaps of the business as usual based on an implementation perspective that we've seen. And some of the previous speakers alluded to it. I think the first from our perspective is HETA really is at the intersection of three sectors. We say health, climate, and energy. And in the various countries where we've operated, it's very, very evident that the one thing that is not happening enough, I think there has been attempts for it to happen, but it's the conversation between health target, health regulations, and energy access rollout. And I think that a lot of the challenges that we face could be, to some extent, partially at least addressed by making sure that there's a coordination between the intent to electrify health facilities sustainably. I think the emphasis here is on sustainably, and the intent to electrify communities, because the health facilities are really based in the communities, right, where we are operating. So I'll give one example in the case of HETA, and we've been trialing that. So it's not rocket science, but there definitely needs to be more of it. We have been speaking with, well, we supported 3 mini-grid developers, I think 3 or 4 in Nigeria, Sierra Leone, and now recently Madagascar. And the conversation was, well, you know, health facilities, depending on where you find yourself, tend to be located quite far outside of communities, right? So one, the connection costs are quite high. 2, you look at them, they are on a social tariff. The incentive for the developer is not attractive, right? So the conversation we've had was, what level of incentive, what level of support would you require to ensure that when you are connecting a community, there's no health facilities, or as much as we can, as much as possible, that is left unconnected, right? And so the most cost-effective, really, based on the feedback that we've received, is supporting or creating an incentive, and that incentive has varied between the connection cost, the subscription fee, and maybe even a subsidy to the tariff to ensure that the revenue model of the mini-grid developer is not affected negatively. So I think those are kind of the conversations that we'd like to see more of going forward. I think from a sustainability perspective, HETA has trialed a couple of business models, and everyone is talking about the benefits and the sustainability of energy as a service. There are various applications of it, but at the moment, you know, if you look at the obvious, like quick wins or the obvious wins within the health electrification spaces, where large energy access rollout programs, whether they are talking with the Ministry of Health to understand different priorities and which areas of overlap happen. The second thing I will say, I will go back to maybe Irene's point actually falls under Irene's point about what level of incentive is required to get private sector to contribute towards this. So we talk about operation and maintenance, but what does it really mean? So, and we've as HETA we say that our value proposition really is emphasis on sustainability. So where we have sort of used the installation model or traditional procurement, as we call it, we are intentional about making sure that operation and maintenance is taken care of. And there's been a couple of feedback we've received. One is 5 year long enough? And the answer to that is no, or the answer to that is it depends, right? So if we know there's a mini grid, or if we know that it's an area earmarked for grid expansion in the next 5 to 10 years, maybe, but if not, is that sufficient? Two is who continuously pays for operation and maintenance? So there is what I would call streamlining of budget, ring fencing of resources at the Ministry of Health level or Ministry of Finance, wherever it's happening, that needs to be dedicated for ongoing operation and maintenance of these facilities. So the donor has moved in, and that's what we're seeing at the moment. There's a lot of commitment towards at least covering the first two. What we've seen the most common is the first 2 years of operation and maintenance. Thereafter, I think there's an assumption that by training the Ministry of Health, there will be sufficient resources. And our lessons have been, unless the conversation happens that says, you used to spend X on diesel, or you didn't have budget ring fence for maintenance of these facilities, how could we create a line item or a platform that ring fences it for the next 10 years? Operation and maintenance will not be sustainable. So one thing that we've been doing is in Sierra Leone and in Tanzania at the moment, we are in partnership with our partners, Resolve, is we are sort of trialing operation and maintenance platform, country level, that requires conversation with Ministry of Health, conversation with Ministry of Finance. And again, it's who qualifies, what qualifies as a claim, what is the process, who gets to have access to it. When there's a strike and the panels are affected, does it qualify, yes or no? So there's an entire process behind it. And I think that we are oversimplifying it by saying operation and maintenance, but you need to get to the nitty gritty, the nitty details, if I'm saying it correctly. And then lastly, I would say planning. So if you, and planning, I would say maybe probably within the Ministry of Health, but also perhaps within the donor community. So what we've seen, many of the solar systems, yes, many are not functional, but also many are now completely undersized for the capacity of the facility, right? So originally it was a health center and it was sized for, I don't know, 5, 10 kilowatt peak system. And then they got additional donated equipment. They added a couple of nurses' quarters that also want to be connected, and there's a kitchen that's been added. So within 2-3 years, oftentimes the system is actually undersized for what the facility, for what was the intended use. So, and that's part of planning. So what we've seen in terms of some of the challenges is we come in, we look at the needs right now. The conversation with the Ministry of Health can be streamlined to ensure that says, okay, what is the plan for this district or for this facility for the next 5 years? And depending on budget, it becomes a budgeting balance, right? Between what you can afford right now versus, what would be sort of an ideal scenario. So I hope I've given you a couple of operational points as to some of the gaps that we see around the regulatory challenges or the implementation thereof.
Thank you, Gracia. I think you also sort of answered my second question around sustainability, but we'll get back to it after Harold's comments. Specifically, maybe in the case of Uganda, Harold, would you be able to share what you think are the most significant regulatory barriers that hinder electrification of healthcare facilities?
Okay, thank you, Daniela. Thank you, Gracia, and thank you, Irene. I think if we go back to, I'll first speak about what ERA does, essentially. So we regulate the generation, distribution, transmission, and supply of electricity, the whole value chain. And the reason that I mentioned that is across each of those points, you're able to have a discourse on how each of those areas is specifically interacting with healthcare facilities. Are they interacting with it from a supply perspective? Are they interacting with it from a generation perspective? In other words, are you dealing with an issue of maybe security of supply? Are you dealing with an issue of reliability of supply? And depending on what you're specifically looking at, Or if you're looking at supply, are you dealing with it from an issue of cost, maybe perspective? And depending on where you are interacting with the health facility, that may pose a different barrier. I'll speak specifically to the most prevalent, and that is the off-grid segment, or those who are hard to reach. So one of the key barriers that we saw in that segment, and we've seen a number of solutions in there, small home solar systems and that kind of thing, with a view, some of them integrated to healthcare facilities. But one of the things that we've seen is that, for instance, in that segment, what we tend to apply is light-handed regulation. The reason we do light-handed regulation in hard-to-reach areas or in off-grid areas or in areas which are really far from the grid is, first of all, to see that for services, electricity services that in one way or the other are promoting, for instance, health, they don't incur unnecessary regulatory costs. So there can be actually a regulatory burden. And how does this, for instance, apply or come out? You may have, for instance, a hospital, which not only provides power for the hospital, but also for the community. Talk of it being, for instance, a shared service electricity company doing the whole value chain. So what we tend to do for such entities, and we've done this for 1 or 2 hospitals, one in the western part of Uganda and one in the northern part of Uganda, is we don't take them through the rigorous, for instance, licensing process. We want you to have, if it's a 7-stage process, we just want it to be like a 2-stage process. Submit a very simple form and then start the development of the project without necessary. And then we also, for instance, waive fees for some of those projects. And then we also don't prove and also support them throughout the process to see that they overcome a number of the detailed things that could actually impede someone from developing an electricity project that is in one way or the other integrated to a hospital. Of course, the other element that we have seen is that across the board, one of their biggest barriers is honestly the sustainability of the project from a cost perspective. The people whom they are providing electricity to, can they actually meet their bills? So they begin to struggle with operation and maintenance. They begin to struggle with the local communities whom they are providing with electricity. So to a certain extent, to overcome that barrier and to deal with that barrier, what we've kind of done in some of those instances is to allow a certain level of cross-subsidization between maybe the hospital facility and the local community. They charge seemingly slightly different services, such that the hospital, in a way, because it's providing a public service, a huge part of its electricity cost and infrastructure, operation and maintenance and all that is borne, for instance, by the nearby community in one way or the other, or to those to whom they are providing for the electricity. So the other barrier, of course, to electrification still goes to the issue of quality, is that for most of goes to quality of service and quality of electricity. So we are talking about reliability. And that is big because some of the equipment that is actually the equipment that hospitals procure, or the equipment that hospitals use, is extremely sensitive to power fluctuations, is extremely sensitive to unreliable power. So we don't put ourselves in a situation where, at least for major areas which require a certain quality of power, they don't have that access to that quality of power. So how we've helped and what we do, we see this as a major barrier to the electrification of health facilities, because naturally it means that it will limit the kind of health services that that specific health facility will provide to the community. Uganda has about 4 tiers of health facilities. We have health centers 3, health center 2, and we have health center 4, and then we have
We're losing Harold a bit.
So generally that at the end of the day, they can extend.
All right, seems we've lost Harold. We'll maybe let him finish his point when he comes back. But then what I'd like us, all right, Harold, there you are.
Sorry, sorry for that. I was just summarizing what I had said is the barriers that we tend to see. The first is, of course, the regulation itself has tended to be a barrier. The second is, of course, the quality of service, and then naturally the cost elements. Thank you.
Thank you very much, Harold, so for the summary as well at the end. I'd like us to talk about sustainability. It's a point we've come back to a lot. We even talked about it on day one, but then how can we ensure that the electrification of healthcare facilities is sustainable, not only sustainable, but also reliable? I'll let Gracia talk about it first and then Irene.
Thank you, Daniela. So maybe before I start, and I can only speak from Heta's experience, I think the comment to the wider industry, and I'd love to hear from Irene as well, is that I don't know that as an industry we have a common understanding of sustainability overall. And I think that once we recognize that, we then need to agree that we maybe need to start working towards a common understanding of sustainability. But broadly, how sustainability is currently understood is the system needs to be operating operational beyond the period of the donor program and or the funding. So it's anything between two key role within sustainability. And then the approach to sustainability has been, I think the technical portion is probably the least complicated portion of it. So you just need to make sure that you've got quality equipment installed based on the sized needs of the facility. And then the trickier portion, which I think is exciting for everyone at the moment, is figuring out the delivery model, or let's say, I'll call them business model, health electrification business models. So in the case of HETA, what we have piloted about 4 standard business models adapted from standard energy access rollout. So one is traditional procurement, which is the standard installation model that UNICEF was referring to. The requirement there has been that we require long-term operation and maintenance. And at the moment, we define that as all equal to HETA's contract period, which is a 5-year program, and or slightly lower. And I know we've been challenged on 5 years not making the cut when it comes to definition of a long-term O&M. The second has been productive uses of energy, where the health center essentially excess power is provided to provide commercial activities, and the revenue generated contributes towards upkeep of the maintenance of the system. We've had lease to own and or pay go for really small facilities. And then lastly, I think energy as a service really is what, from a sustainability perspective, ticks all the boxes. So what is a sustainable approach in our view? Coming back to Irene's point, participation of the private sector, performance-based models has often led to sustainability, because the private sector only gets paid per kilowatt hours and or per service rendered. And so there's various ways of doing that, and there's various challenges to achieving it. I think in the case of a mini grid, relatively simple. What the funding gap there would be who pays for the connection, who pays for the subscription fee. Oftentimes the health centers in rural areas do not have those kind of budgets, and do they have the required funds going forward to pay for, even if it's a lifeline tariff, right? We know that in rural health facilities, you are displacing a cost, whether it was for vaccine, whether it was for salaries, whether we know that you are displacing a cost. In the case of, let's say, standalone system or off-grid systems, it's slightly more complicated, particularly when it comes to health, public health facilities. And it goes back to Irene's point. Do we understand as a community what is required to make this project attractive for the private sector? And in our experience with HETA, especially focusing on health facilities, energy as a service remains the preferred approach. However, there's very few if not any, private sector that would put up their hand and say, I'm prepared to put $1 million, 500,000 or $5 million upfront to electrify health facilities, they will start citing the usual suspects, so ability to pay, risk of non-payment, the size of the facilities are too small, they are dispersed across the region. How do you lump them into a portfolio that's then attractive? And then at the end of the day, coming back to the regulatory framework, who signs the contract? Who's liable? Who pays for it? Is it the facility? Is it the district health? Is it the Ministry of Health? And so all of that triggers its own set of regulatory challenges in its own. You know, Ministry of Health, most public procurement have to go through a tender. You're talking about 500,000, a million, maybe $2 million. You know, it's a 2-year process at best, if not 3-year process. So how do you structure it in a way that's attractive? So some of the lessons that we've learned there are, yes, to private sector, but there are conditions to that. And a lot of it is how do we then as a community come up with mechanisms that make this attractive and de-risk the private sector investment? In our limited, let's say, experience, the lessons there have been that there has to be some level of subsidy, capex subsidy. So we've seen anything between, I don't know, 50, maybe 70, even 100%, just to ensure that the repayment on the health facility side are then become affordable. The second has been what happens in case of non-payment, because regardless of subsidized capex, there's still ongoing running costs. So what mechanism do you have in place? A loan guarantee, that's in principle a very nice concept. Does it work at such a small scale? You know, do you only put together a loan guarantee for health facilities, and to what scale? I think that's the next challenge. And then lastly, it's also been around size of the market. So most private companies that we've spoken to are either mini-grid developers about to enter CNI, etc. So it's really competing for resources and where they are likely to make the most return. And so having the conversation about 20 or 100 health facilities versus focusing on one maybe larger private hospital with a 500 kilowatt load, those are the kind of feedback and discussions that we are getting. So I'll say energy as a service definitely holds lots of promise and lots of interesting lessons with the work that's been done in Uganda with the World Bank. But there are definitely hurdles that as an industry we need to address. And those are some of the early lessons that we are seeing within the HETA portfolio.
Thank you very much, Gracia. You keep alluding to my next questions. My next question is around how do we incentivize investment in electrification? But before we go on to that, I'd like to encourage the audience to ask their questions via the Q&A box. And also let Irene answer the question around how do we ensure electrification is sustainable in healthcare facilities.
Thank you. So I don't have a lot to say because I fully agree with everything that Gracia just said. The question of the definition of sustainability, I think sometimes I always come back to that, because sometimes when we think sustainable, it's like, oh, yeah, we provided enough grant at the beginning and it's produced by renewable sources. That is sustainable. We simplify a lot what sustainable means, and sustainable for me also takes into account the concept of affordability of the whole thing. You know, that is sustainable. It means that I will be able to provide electricity access and SDG 7, the whole thing, meaning affordable, meaning clean, meaning blah blah, until the forever, or basically the lifetime of the project and even more. So that's for me sustainable. And if, for example, what Gracia said, so for me, one of the things I found, especially in my previous experience as mini-grid developer, it was that you don't know who is the person or what is the organization that has to pay. So how is that going to be sustainable? Yes, you can find a solution, but it's always a temporary solution. So at some point in the 20 years for which you invest on the mini-grid, you find a problem with that. Who is paying me? And then people say, I don't have the money to pay, which is understandable, but at the same time, you need to show profitability to your investors and your equity providers. So what are you supposed to do? And especially knowing that a lot of times a health center is not is not the client that is going to consume the most. Yes, of course, there are some examples in the last mile that you can find refrigeration for vaccination, etc. But the reality is that most of those health centers, what they need is lighting to avoid giving birth in the dark, etc. At least that's the first stage. And a lot of times also the health centers, they are not situated in the center of the village, but more in the outskirts. Meaning that as a developer, you need to draw the line, which is very expensive, line and poles and everything, for a connection in which you are not really sure who is going to pay you, and you know it's going to be complicated, and at the same time for not a big consumption. What are the incentives there for a private developer to do that? And what is even worse, in a lot of the tenders, the way they are structured is like you cannot have double grant on the investment. So basically, if I get 50% of my capex subsidized, I cannot go for more capex subsidization. The rest has to be equity or debt, but I mean, it cannot be grant. So that's where you are stuck as a developer, like, okay, I don't want to be that person that is saying, no, health is not important, of course not. But it's really complicated and tricky, and especially knowing the difficulties that already off-grid, and I'm talking about mini-grids because I know that better than solar, but still, knowing the difficulties of, in general, of electrification of grid, imagine to add on the top of that, like, okay, I know this is going to be extremely complicated. Do I have the time? Do I have the resources to really do that? So that is extremely problematic. That's why I think what Gracia said about what does it mean sustainability, it's super important to address from my point of view. And it means not having to deal with that. We need to think in a different way. We need what Gracia is saying, energy as a service. We really need to start thinking about that. But the way right now that we do off-grid electrification makes it very tricky and non-attractive for private capital to really go and electrify the health centers. And also, one last thing, when we talk about profitability indicators, the problem you find with health centers is that you don't see immediately all the benefits. So for example, of course, you are spending less money because if you have preventive medicine, for example, you won't have to spend money later on fixing diseases that could have been prevented. But how do you factor this economical gain into your mini grid or into your, P&L? I mean, that's what is super tricky also.
Yeah, definitely. It is super tricky to factor that in. But I'd like us to answer the next question around how we can incentivize the private sector. And I'd want perhaps Harold to help us with this one. And how can regulatory frameworks be designed in order to incentivize investment in electrification for healthcare facilities in remote and underserved areas? Sorry.
Thanks, Daniela. You mentioned two things which I think are important. The first is in the remote and the underserved areas. But I also think that there is a place for incentivizing private sector participation in the healthcare centers, even in areas which are not remote. I know we tend to focus a lot on the remote, but also remember, like for instance, some of the major health facilities that actually provide essential services are on the grid. So what's the first thing that we can do? The first thing that we can do is to deal with the issue of costs. Two things, costs, and I think operation and maintenance, especially from that perspective. One, we can incentivize the private sector by providing very clear rules on what will happen when the grid integrates with that health facility, or what will happen when the main grid interacts with the off-grid, which is supporting the health facility. That is important because it gives incentive and it gives perspective and predictability to the private entity. And one of the things that we definitely provide in whichever regulatory framework is that whatever happens at that point in time where the off-grid power developer who is providing also health services, is integrating with the main grid, there will be adequate compensation. That's one of the things that's one of the rules that really I think we found incentivizes the private sector. The other way you can also incentivize the private sector, especially towards the issue of cost, is knowing that most of these health centers, knowing that most of these off-grid health-related facilities tend to suffer from challenges on operation and maintenance. If there is a main grid operator or there is a larger developer within that area, a certain element of that operation and maintenance over and above the usual regular maintenance can be taken into account and can be done by the large developer. We've seen that. We think there is a possibility for that working such that this private developer knows that, yes, he's going to take the burden of operation and maintenance up to a certain level. But if it becomes significantly costly, there's a possibility of the grid that is closest to him, whom you typically call, for instance, the supplier of last resort, being able to step in and support the operation and maintenance and not necessarily charge for that, and not necessarily also take away the off-grid, which is supporting the healthcare facility. That's another way you can think about it. Of course, it comes with its pros and cons, because naturally you are thinking that there may be a duplicity of cost. There may be an instance where someone is actually not is already getting provided for the operation and maintenance. You don't have line of sight, you don't have all the data. But at this point in time, you're looking at the public amenity being provided and overcoming that with the perspective of the greater good, the public good, to see that if there is a critical health care facility, to a certain extent, it's able to receive support from the closest, from the closest main grid operator. That's another way, which I think we've looked at to see that it can be an incentive for the private sector. The other element is on the supply side, which is really at the end of the value chain, is what are the costs that healthcare facilities are going to pay for the electricity. One of the things that definitely becomes critical is that if you're to look at the regular tariff categorization, regular tariff development process, you're looking at the technical impact of the project as well as the cost. But you can defer that by giving healthcare facilities a certain level of preferential tariff over and above, slightly or significantly much lower than what they would ordinarily pay. The reason why, as a regulator, you may want to do that, or you could do that, is to see that at the end of the day, utility bills are not one of the things that are stopping this healthcare facility from actually providing essential services. There are many bottlenecks along the way that this healthcare facility is going to face, all the way from the infrastructure to maybe telecommunications, to maybe operation and maintenance, to maybe taxation. So you can shoulder what you can shoulder as a sector and allow a certain level of cross-subsidization for what you typically call public amenities. And I think healthcare facilities are some of those facilities which you can do that for. You also want to think through the kind of healthcare facility and how many people that it is serving. Naturally, to do that, you want to think of, for instance, if it's a major referral hospital serving hundreds or thousands of patients of healthcare, so many people, you want to give it a tariff that is almost as competitive as someone who is, for instance, doing, say, an extra large facility, which may be doing something else contributing to the economy, like manufacturing, like that is to, for instance, categorize healthcare facilities with other kind of facilities and giving, so that you can provide them a preferential tariff. And if you do that, then I think that's one of the ways as a regulator you may be able to incentivize the private sector to actually get involved in, and the private sector to actually get involved in the research sustainability, there is predictability, and that you have significantly reduced the regulatory risk for the healthcare facility ultimately. Thank you.
Thank you, Harold, for those points. They're noted. Gracia, you talked about it a little bit at the beginning, but then are there any other points you'd like to emphasize on incentivizing investments in electrification?
Thank you, Daniela, and thank you, Harold. I think I will just add one more contribution from our side, and this is also feedback that we've received. So I was speaking to a couple of donors. Health electrification always requires capital. And the feedback was, we keep hearing about business model, we keep hearing about sustainability, but we have not seen the data to back it. And I asked, what does that mean? She said, of the systems that you've installed, what has been the tariff? What has been the monthly fee? What has been the default rate? What has been, how long are these contracts being signed for? What were the challenges, etc.? And so I think as HETA, we've taken that on as valuable feedback. And I think that data has to be able to, back up our claims, right? That say energy as a service is indeed the most sustainable approach. And you have to show that across the operation, number of hours, kilowatt hours, generated availability, but also operation and maintenance. And you have to be able to then use that data to say, here's private sector, here's the data that you're looking for. One example is in the DRC with one of our partners. It's semi-private, semi-public facilities, but in remote areas that have committed to making payments over a 10-year period, and the default rate has been surprisingly low. And so for us, that's a positive story to tell. So I think that just saying that part of incentivizing the investment is being able to collect the data that's required to back our claims and to start having this conversation with the private sector. The second feedback I'll give is I was speaking to one of the developers. They were approached by a relatively large, I think, public facility. So it's an attractive project size by all means. And they mentioned, what about they called it the newspaper test. So today, if the facility defaults and they cut power, they know they will end up in the papers, right? And no investor wants to end up in the paper for having stopped electricity at the public health facility in a remote community on the continent. And so who then takes the risk to reassure the private sector that in case of a default, here's what we've put in place to ensure that you do not lose the investment that you've put. So those would be the two sort of contribution to this discussion that I would add.
Thank you very much, Gracia. We have two questions in the chat. I'll read the last one. Harold, somebody would like to get in touch with you to touch base on solarization project Gavi Alliance. So we have Karen from Gavi. If you allow, I could share your details with him via his own personal chat. All right. So I would do that, Karen Sagar. We also have somebody asking if there are any organizations working on the health center electrification in the sub-Saharan countries, and he's happy to cooperate with them in Ethiopia. So perhaps I would share these details with Gracia, and if there are any other organizations that would like to cooperate with Fenta from Ethiopia, please note down his email address, his or her email address. Yes, thank you very much. I'd like us to talk about perhaps international practices that can inspire African countries. We talked about what could work on the continent, but perhaps there are other practices from other countries that are outside of the continent that could inspire us. So perhaps, Irene, if you have any examples, or Harold or Gracia, it would be interesting for us to hear from you.
Maybe, Daniela, so I to be fully honest, I don't have specific examples, but I think there's some international thinking that we need to put through. So for example, and let me, because I'm thinking and speaking at the same time, but so we go for sustainable growth, right? And that is one of the SDGs about clean growth and sustainable growth, etc., etc. But sometimes I think we are not using the right parameters to measure growth. So for instance, when you are a developer of grid, whatever sort of home system, mini grid, you look for growth, but for growth, usually it means more consumption and more revenues. But maybe we are not taking into account the correlation between growth and development. So that is something we need to take into account. And if you look at if you look, for example, to more developed activities, the correlation between growth and development is not always there. So we really need to pay attention between those two, because we do assume when we electrify that growth and development goes hand to hand. But I'm going just to provide with an absurd example, but just for illustration of what I'm saying. Let's imagine that we electrify a village, and in that village there is a lot of consumption, but most of that consumption is just linked to TV, to see a soap opera. And in another example, just taking the opposite example, a village is electrified and there is a very light consumption, but it's all focused on health center and the school. So if you just look at the parameter of growth in the consumption, you would address, you might go to the wrong conclusions. I don't know if I'm explaining myself. So when we talk about health centers, we need to have, and it is a case for the projects that are electrifying specifically and targeting health centers, but for the general electrification projects, I think we should have more advanced targets and incentives, as was the previous question, but really targeting the idea of health centers, because it cannot be only related to growth, to consumption. It has to be related to more than that. So for me, that's something we need a lesson learned from other geographies. It has to be that it is not always going to be related to consumption and thus growth. Yeah.
Gracia, any examples you'd like to share?
No, thank you, Daniela. I think that as HETA, we've mainly focused on sub-Saharan Africa, so I've got limited examples internationally from, let's say, best practices of health electrification. By the compact, I think there's examples of successes and maybe I'll say challenges of large-scale rollout out of India, and also I think the one component that sometimes not taken into consideration is, especially in the case of HETA, so it's digital connectivity and health electrification. Digital connectivity it could be defined in many ways, but we've two things: internet access, but also with health management information system to improve population health, track data, HIV program rollout, or malaria. And oftentimes the training required to ensure that these systems are successful at the health facility level is definitely continues to require more and more effort. The second is the link between digital connectivity and operation and maintenance. I think that's one thing that's often overlooked. So in a couple of the facilities that we've worked in, yes, we require remote monitoring, but if the facility does not have the budget nor have the resources for having internet access, so remote monitoring almost become insignificant. And the feedback we've received from our partners in full transparency and with good intent has been, we are more than happy to install controllers, we are more than happy to give you live data, but who will pay for the internet? And are you prepared to put up your hand to pay for internet for the next 5 years? And in some parts of the continent, you're talking not $50 a month, you're talking $100, $200 a month per year. That's 2,000, 400. Who covers that for one facility? And so those are conversations that we are having as HETA. So the digital connectivity, the link between operation and maintenance, health electrification, digital connectivity, sometimes it's not is not discussed enough or emphasized enough.
All right, thank you, Gracia. I'd like to end with one final question around how we'd like to see regulatory bodies collaborate with stakeholders such as yourselves, HETA or SE4All. How can regulatory bodies collaborate with stakeholders such as yourself to develop and implement effective policies for healthcare electrification? So I'd like to start with Irene.
So I think I think definitely there's a discussion to have, and sometimes I think it's important to listen to what developers are saying. And I'm not saying it's always the case, but it's not, sometimes I heard like allusions to the fact that developers, they want to earn as much money as possible, etc. Yes, of course, they need to have high returns to attract equity. Most of the time, it's not even your call. As a developer, you need to attract equity, otherwise you don't finance your project. And I can assure you that it's not the developers the one who is deciding the cost of the capital. So when you get a tender in which you get asked, are you going to electrify the health centers? Are you going to fight against malaria? Because that's a typical question for a tender. How are you going to fight malaria? And in that moment, place yourself in the side of the developer. You are trying at the same time to get your equity close, to get your grant disbursed, to order for your batteries, to blah, blah. And you don't have the time cost revenue analysis, the cost that it requires to actually connect that health center with everything, and I'm not going to repeat that we already discussed in this panel, is way higher than the expected revenues. So it's not a matter of not caring, it's not a matter of that, it's a matter of a proper resource allocation. So that's something as developers we've been claiming for a long time. It is, for example, and I'm going to give a very clear example, when I've been doing surveys to select villages, in the case of electrification tenders, health centers are not even a parameter that is interesting, because it's just a nightmare. It's just a nightmare as a developer. So that is something very important, I would say, and that needs to be addressed. So I think that when we have this discussion, but with commitment, because I went sometimes in several countries to discuss with the Ministry of Health. Yes, of course, but we pay the villages so they can pay you. Yes, but that's not going to be enough. I really need to convince my investors and explain to them how I'm 100% sure I'm going to get paid with that. So we need to reach agreements. And for example, one of the things that could be done when a tender is prepared for electrification with mini-grids or solar home system, why don't we include already in that tender a certain agreement, but clear agreement with the Ministry of Health saying, okay, you have to electrify these centers and you are going to get paid directly via the Ministry of Health of whatever, and we fix that. But that has to be fixed before the tender is launched, because then you don't have the time to think, you just have to execute. So I think that when preparing a tender, I think that donors could have in mind that idea of really preparing that part.
Thank you, Irene. Gracia?
No, I think Irene has flagged sort of a key point. Maybe my addition to that would be that the public sector will always say that, you know, the private sector has a particular agenda. And in my previous role, I came from the private sector. And if you look hard at the numbers of the companies and the challenges that they are facing, the feedback would be that many are struggling just to survive, actually to stay alive. And so maybe the plea here with ERA, and it's been great engaging with Harold, is that as we put in place these programs, because we're seeing that happen, right? So there's, I think ZC in Zambia has included public facilities, which could be schools or health facilities. As I see that also RIA is looking at a number of health facilities within the communities that will be electrified. As we are planning to connect these facilities, let's also have the discussion, the honest discussion in the private sector that says, you know, what would be required to make this an attractive value proposition? And the ask would be, let's listen to the feedback that has been given. So an assumption about the cost of connection versus the actual, you know, challenges of putting together an application that's approved, the due diligence, getting access to the RBF, et cetera, is completely different, you know, theory versus reality. And so the ask there is that as a community, I think let's together perhaps work towards creating an incentive that stimulates private sector participation, but also takes into consideration a lot of the risk that at the end of the day they have to answer to their investors. So the conversation should happen between compliance, performance, but also, let's say, private sector incentive. Yeah, that would be my feedback.
Thank you very much. Harold, would you want to share how maybe perhaps regulatory bodies are, as yourself can collaborate with other stakeholders to end?
So I'll just speak to one specific collaboration we've had, and I think we've had that with the UNDP. It's actually surprising that when we wanted to do, when we wanted to get the majority of the customers to move towards electric cooking and commercial and all that, the facility that we actually chose is a healthcare facility for a number of reasons. We chose a healthcare facility because of the number of people that it interacts with, the whole concept of health, and it worked brilliantly. We were able to move that hospital from using biomass to actually using electricity. My point is that there is room for collaboration between the energy sector and the health sector, and also development partners in whichever form they may come through. Now, the important thing is to also get the synergies and then understand what we want to achieve at the end of the day. Are we looking at, and at which point do we want to intervene? Do we want to intervene from the customer's perspective? Do we want to intervene from the perspective of the private actors, the equity providers, as well as the banks? One of the things that obviously that I still want to reiterate is the need for data. Reason being is that after we picked that data, we were able to understand what would be the challenges of large customers and all that beginning to use and beginning to use the electricity for cooking. And from that, we're able to develop a methodology which we're able to roll out to the greater public. So depending on the data that you pick, there's a lot of room for collaboration, and clear discussions have to be had on that. The other way we've also collaborated with various actors is to provide for, is to see that we support, for instance, dedicated electricity lines. And this has come through various support from, for instance, grant partners and the energy sector who have worked with the sector to see that there are dedicated lines for purposes of reliability to health centers. So there's a lot of room for collaboration. It really just depends on your interest, how you narrow down on that, and how you come up with a methodology that works for each and every one of you. Thank you.
Thank you very much, Harold. Unfortunately, my time is up, and there's a lot of background noise on my side. But I just want to thank you, thank our panelists for answering all the questions. And I'd like to encourage the audience to join us tomorrow for our final session. We'll have a recap of all 2 days by Charlie from SE4All. So make sure, if you haven't been able to attend day 1, or if you're listening to this, you've attended day 2, but then if you haven't been able to attend day 1, we'll provide a recap of what has happened, and we'll talk about the actions. So what's next? Recordings will be available on our website, and we also encourage you to check them out, and to look at, to also check out the event by SE4All coming up in February around healthcare electrification. And we'll see you tomorrow. Thank you very much.
Thank you.
Thank you.
Thank you.